Welcome to NAMI Finger Lakes Family Forum. Thank you everyone for joining us for tonight's program. I'm NAMI Finger Lakes Executive Director, Beth McGee. Before we begin, I'd like to take a moment to acknowledge and honor the grieving that communities are experiencing across our nation this evening over the many lives lost in Atlanta last week and this week in Boulder, just a half hour's drive from the community that we're going to be learning about tonight. These are traumatic events that find us needing to shore up our hearts and minds again and again when we're already collectively processing so much loss in the last year. So please join me for a moment of silence to give space for this grief and to consider those people who have been taken from those who love them. Thank you. Family Forum is a monthly program NAMI Finger Lakes has provided in cooperations with Tompkins County Mental Health for over a decade. On the fourth Tuesday of the month, we offer presentations and discussions on topics of interest to the mental health community. This event is being recorded and will be available on the NAMI Finger Lakes YouTube channel soon, where you can also find our previous forums on crisis response. NAMI Finger Lakes is your local affiliate of the National Alliance on Mental Illness, the largest grassroots mental health organization providing support, education, and advocacy for the millions of Americans affected by mental health conditions. Locally, NAMI provides a helpline, support groups, and education programs for families navigating mental illness. All of our services are free. To learn more, you can visit our website at namifingerlakes.org. After tonight's presentation and discussion, we'll have an opportunity for questions. So please hold your questions until that time. And in the interest of time, so we can get to as many as possible, please submit your questions using the chat. So let's get started. Tonight, we're excited to welcome Chris Richardson, Associate Director of Criminal Justice Services at the Mental Health Center of Denver. Chris oversees the daily operations of the Denver, Colorado S.T.A.R program, Support Team Assistance Response, that provides a civilian-based response to low-level 911 calls. Chris has 14 years of experience in direct clinical services in the field of mental health and also oversees Denver's Co-Responder Unit, a program that pairs licensed mental health clinicians with Denver police officers. Welcome to Family Forum, Chris.
There we go. Thank you for having me.
Sure. And thank you. You're really generous to be here with everything that's happening in your communities in Colorado. So we're really, really grateful to have you participating still. I think I'm going to go ahead and make you a co-host, and you can share your presentation, tell us a bit about yourself and the program, and then we'll have a discussion I mentioned earlier, and then we'll take questions from the attendees.
Thank you for having me. My name is Chris Richardson. I work with the Mental Health Center of Denver and have for 14 years. I think my passion has always been on giving voice to individuals with co-occurring mental health and substance use that tend to be in our system and feel powerless and don't have those ability to have an advocate in their corner at all times. So kind of found my way into the criminal justice system and have been able to kind of create supportive options where it's not only getting the right person to the right long-term services that can provide support and care, but it's also working with stakeholders that don't understand mental illness and the complexities that come with it, and getting them to understand a little bit better about how we can work more collaboratively to get better outcomes and also change kind of how we view those experiencing mental health distress and concerns. When we're talking about S.T.A.R, which is our, Denver's brand new kind of program that started in 2020, I I always like to kind of discuss a little bit of our co-response. Our co-responder unit started in 2016, and it was 4 clinicians that were tasked to be embedded in Denver police and be able to ride with officers to mental health based calls and be able to provide a clinical lens where often police didn't have tools at their disposal. They didn't have system navigation. So when we started in 2016, it's how you would probably most experience the joke of a social worker and an officer go into a bar. It was literally that. It felt like this awkward pairing. No one really knew what to do with us. We didn't know how to interact with them. And I think it was 90 days of just that awkward first date of how are we going to make this work? And I think as we developed our co-responder program, and built relationships and really showed what value we could actually bring with calls and how we could de-escalate people and how we resonated with people, viewing things from a clinical lens and being able to really engage it in a person-first, trauma-informed based lens and still get a very positive outcome that also involved a longer-term support on the back end, that we really started getting buy-in from police of this is a really great model. So fast forward 5 years, and now we've moved from 4 co-responders to almost over 40 and soon to be a 24/7 model. Now, the funny thing about social workers is if you're going to give us a police radio, we're going to have questions when we start hearing stuff on it. So what we noticed right off the bat was there's a lot of stuff that comes across 911 that is social in nature and doesn't have a criminal justice nexus. But the only way that Denver had to respond and has forever is send fire, send police, or send EMS. And what we decided, we just started questioning, why are we doing this? And police kept saying yeah, we're not sure why we're going on this calls, but we don't have an option. And that's when we heard about this lovely little middle of nowhere town called Eugene, Oregon, and they had this civilian-based response unit called Cahoots. And that's when we started really delving into the idea of what a civilian-based model without law enforcement presence could be related to 911. So when we talk about S.T.A.R, especially from the Denver model, we're not talking about one or the other or one replacing another. We're talking about having a co-responder that really are responding to that more higher acuity level. And then the civilian response that is really responding to the more social levels that come across 911, where there's not a criminal justice nexus, but it's just behavior that really needs the more clinical intervention versus a law enforcement intervention. Just some general data as we're noticing through our co-responder unit is that we're noticing increased calls that are related to behavioral health. From 2018 to 2019, we noticed 911 that there was a 33% increase, which is huge within a city the size of Denver. Last year was about a 12% increase from the previous year, but that probably was impacted a little bit from COVID when we hunkered down a little bit. And we definitely started noticing towards the end of COVID that there was a higher level of mental health calls coming across 911. With our co-responders, the ones that we tend to go to, Denver separated into 6 police districts. Welfare checks are our main one that we're going on. That's usually individuals calling either on themselves or a loved one saying, hey, I just have some concerns about this person. Suicidal individuals. Other is our catchment area for anything that just kind of comes across of the community saying something seems off about this individual, whether that's walking down the street, talking to themselves, laying on sidewalks, throwing things, whatever might look like, just kind of the community might not understand what it is. And they call 911 saying, I think someone might need some help. So as we kind of move forward into this idea of a civilian response, what we really noticed is that on the 3-year average that we're just continuing to see behavioral health stuff crop up on 911 based systems. And I think part of that is, what is the first number that you're asked to remember when you are 2 years old? It's always 911. If something is going down or you have a problem, 911 is the call that you're asked to make. And that has not stopped. And we haven't really developed our crisis system to kind of look at that 21st century of what is coming across these crisis-based systems. Instead, it's always been that main response. So when we went up to Eugene, Oregon, what we noticed, we brought up the Mental Health Center of Denver, Denver Police, 911, Servicio de la Raza, Dasher, Denver Justice Project, and basically a lot of community members that want to have a say in how do we bring a model like Eugene to Denver. we were there 3 days. They are the greatest human beings. I think guys said you had them on last month. They are some of the greatest people on the face of the planet. They basically let us raid their knowledge chest and take everything that we could to kind of bring it back to our community. That included our 911 center going to their 911 center and spending a whole day just to see how they triage calls and what they look like. And then allowing us to kind of be on the van and actually see how their interaction with clients in the community was, and how they were able to kind of work as a full-blown community to help support the needs of an individual. We took all that information and brought it back down to Denver, and that's where we really started getting kind of into the nuts and bolts of how do we as a community determine what this looks like. There was a lot of voices from philosophical, where this should live, who should be the implementer of it, the philosophical design attached with it. And then it was just kind of a throwing things across the wall to say, how do we make this distinct to Denver, given that we're a little bit bigger than Eugene and we need to make it really responsive. So when we launched this thing, we decided we were going to do a small rollout, really small and intentional, so that we could measure data and see what an informed decision for a rollout citywide would look like. We used 911 data to actually show that during the days between 10 a.m. and 6 p.m. were the highest call volume for the type of calls that S.T.A.R would go on. So we went from 10 a.m. to 6 p.m. Monday through Friday, and then make modifications because we didn't have anything set in stone of how we were going to respond. We really didn't have any policies or procedures. It was like, we're going to do this experiential and just kind of see how it works and then be able to fine tune as we move along. As you can probably imagine, this little thing called COVID happened last year, which really threw a monkey wrench in a lot of planning. We would have loved to start this program back in April 2020, but because of the unknowns about, safety and what the risk might be associated with that, we had to kind of push pause. But what we kind of noticed as we moved on in that pausing period is that there was a lot of communities that had to shift how they were providing services to clients. It became a very virtual world. It became a disconnected world. People that had long-term supports no longer had access to those long-term supports, and people started feeling more isolated. And that's where, as a stakeholder in the community, we kind of just said, we need to be an entity that leans into this problem and helps support people that don't feel that they have a connection point, and can be that middleman of how do we make sure that our disenfranchised still have connections to the back end support. So in May, I think it was May 24th, it was determined that we were going to launch our pilot on June 1st, which for city terms is about 5 days. And I got an email that said, hey, we're starting Monday. And I was like, we don't have anyone, but I guess we'll just hop on the van. It'll be fine. We'll make this, we'll figure it out. So, being at, we had every intention to have a full-time person, but, being able to hire someone during that time was a little difficult. So I had the luxury of being able to be on the van and really see what the ground level work would look like and what kind of response it can be, and how do we mold this into something that can be really supportive and creative to Denver and the community that's been impacted by the ever-shifting landscapes and stuff of that nature. The big part of this is that 911 is the mechanism point for which all of our dispatching is taking place. There was a discussion about setting up an independent phone line. The lift of being able to staff a phone line on top of who was on the van was a little bit, probably a big lift. So we utilized 911 and just were able to train the dispatchers to be able to triage the right call. And that's weeding out safety concerns or high level safety concerns, whether that's weapon or aggression. And then once they kind of had that ability to understand what our skill level was and what our capability was, being able to dispatch us to the right calls. Because of that working relationship that we have had and forged through the co-responder program, 911 felt pretty comfortable of our skill set already. So there wasn't a lot of hurdles or jumping through hoops. We knew how to use the radio already, so we were pretty adequate in that. I think the biggest thing is we showed efficacy right off the bat of not kind of meddling too badly in the system via either messing up the radio over chatter, going to a call we're not supposed to be on, stuff of that nature. And it's been super collaborative, even on calls that 911 isn't sure if we would respond on. They just ask us to give them a call, and we give them the feedback of, yeah, that's something we could easily be able to respond to. So it's a very back and forth relationship of what is appropriate response and what is not an appropriate response. There is no uniformed response on this van. It is a paramedic and a licensed clinical social worker. I think in the future, there's a likelihood that we may have a small version of what a uniform may look like, but I got to show up and do the van thing and relate to people in the community wearing jeans and a t-shirt, and my colleague on the other side. I mean, it really was, how do we make the lowest barrier kind of connection with people, where a uniform or kind of the more tactical approach doesn't need to be a thing. And then a big portion of what we do is, as we were in that learning curve, it was a recognition that we know the Denver community. We know the individuals that need support. We know the individuals that are unhoused neighbors, and being able to, if there isn't anything that's coming across 911, to be proactive in the van and really reach into those communities and offer support, assistance, community connections as needed, but really develop kind of what a relationship would be. And part of that is also breaking that historical understanding of when someone comes and talks to you, it doesn't always have to be police, which I think was the thing that we noticed a lot of people was kind of that being taken back that we weren't police and that it was a different response, and kind of that joking moment of like, yeah, this is something different. Let me explain what that looks like. And here's some water, here's some snacks, and here's what we can offer to you, to that individual. So I think that's what allowed us to kind of build that initial reputation of what a civilian-based response could be. This is kind of a heat map, essentially, of the type of calls that S.T.A.R would respond to and where it is historically located within the Denver community. This big hot spot right here is the downtown corridor area. This is kind of our main thoroughway that leads south. And then we have this, which is our makeshift homeless shelter during COVID times. So what we're going to be looking at as we move forward on our S.T.A.R expansion is kind of how are we making sure that we're at these specific points to be able to respond citywide, with an acknowledgement that we don't want to have a van staffed in this area that has very little calls when we're going to have people swamped over here responding to these calls. So making sure that we're really data driven and data informed as we roll out kind of the expansion. To date, we've been on 1,095 calls. None of those calls have yet to involve us having to call police for backup. We've been able to self-resolve every single one of those calls on scene, either through transport, either through on scene and just being able to walk away. But I think that's one of our proudest accomplishments right now, is that we're proving that the model can be responsive without having a law enforcement presence. It's not a matter of when or if, but when. There will be a time where we probably will have to have police backup. And I think at this point there is that relationship where if a little over 1,000 calls that we haven't asked for help on, if we're asking for help, that means that we're probably in a situation that definitely warrants it. And I think having that partnership to some degree is definitely beneficial in those situations. It's also important to note that I think it was because of our reputation with the co-responders and utilization of a clinical lens. About 23% of these calls are actually calls where officers are on a scene and recognize there's no law enforcement need, and they're requesting S.T.A.R to come and kind of relieve them of what that situation is. That does two things. One, it's sending the right response to that individual to meet their needs. And two, it kind of transforms what the badge is looking like. Instead of it's like, this isn't my problem, I'm walking away. It's a law enforcement entity saying, this is something that I think I can get the right person here. Let me call them. Now I can walk away. I hope you do well. I hope you're doing well on your, and I think that every time we've had those contacts, the citizen is really grateful for the officer for calling in a response that can better meet their need. And we've been able to help that individual in crisis. I love this data because it really shows there's been a lot of discussion of why do you need both kind of crisis response, either STAR or co-responder. Our co-responders really do respond to the higher acuity level calls with the ability to deal with weapons, higher level of suicide, homicidal ideation, just domestic disturbances, DV, stuff of that nature. And this really shows that what STAR is responding to, co-responders really aren't, and what co-responders are responding to, STAR really isn't. So they really mirror each other really well. And they are in the same system, so they can coordinate as needed. I've worked with a few co-responders that have been able to de-escalate a situation, but because this person didn't need to go to the hospital, they needed to go to a walk-in crisis center, and it wasn't trauma informed to bring that person in handcuffs by police. They just asked if STAR could come in and transport that person, which naturally we're absolutely on board with. And then because of the clinical lens that we're looking at, most of these calls are presenting with mental health. They are presenting with co-occurring. As we collect our data, we're making it very intentional that we are not diagnosing on the fly. We're not meeting with people for 15, 20 minutes and saying you have schizophrenia. Unless we have knowledge of that, history of that, we are not doing a snapshot of mental illness because we don't want to further stigmatize the idea of what mental health is. We want to be really intentional that unless someone is giving me like, yes, I am suffering from bipolar disorder, that we would not document that individual as having, it would be a deferred diagnosis. Same with co-occurring. We may think that individual may be under the influence of something, but unless they're reporting it, we're really not making that leap to conclusions attached with that. This is just in general what 911 calls for service are. So right now, the way our system's set up, it's police, fire, and EMS. And I think right now the goal is to provide a behavioral health fourth leg to this, to be able to have a unit dedicated to be able to respond to those behavioral health type needs in collaboration with the Department of Safety. This is kind of what a STAR expansion, if you know Denver at all, would kind of look like. Downtown corridor area is the hottest spot. I think it's going to be a basketball analogy, but we're probably going to be playing a zone defense instead of putting one van in each district. It's going to be kind of centered around downtown with the ability to expand and contract as needed. And then finally, I think our most interesting stat is we're actually about 12 minutes faster than the average police response. And I always like to preface this on when we're responding to individuals in the community, time is not our enemy. Like we will spend as much time as we need with an individual. I think that's sometimes the most dangerous part of crisis response is the desire to want to finish something fast. And that is not our intention. But what we're noticing and what we hypothesize is that because I've been a clinician forever and I know systems and I know relationships. I know when someone says I need X, Y, Z, I know where to take them to. And that's what I'm able to offer them immediately. So I start about 10 minutes faster than what the average officer would be that doesn't know the system as well. I also know the integration of crisis systems, the walk-in crisis systems, how to access people into services with low barrier options. And I think that actually is what's saving a little bit of time, even though time is not the goal attached with that. And then, it's one of those fun things. If you do a program well, your best hope is that someone throws money at you. So in November, our mayor actually said that he is taking, carving out 1.4 million of a budget to be able to expand on the STAR response. And that hopefully is going to be going out to RFP in the next week or two to hopefully have about 6 vans, a staff of about 12-ish individuals to really be responsive. And I think we've talked a little bit in the past about, do we want to make this a 24/7 model right away? And our goal has always been, we want to be thoughtful and intentional with how we roll this out. We want to expand it citywide. And then if we feel confident that everything is worked out citywide, then we're going to be looking at the next expansion being a 24/7 model, and then hopefully a here to stay kind of concept where it is rolled into a budget where we don't have to worry about budget cuts related to this program. So that is basically the nuts and bolts of our presentation, and totally open to all the conversations that can follow.
That was great and really informative. Thank you. one of the things that these presentations do at the beginning is often answer so many of the questions that we had. So thanks for being so prepared. I appreciate it. I wanted to read a quick quote that I found in your local newspaper, The Denverite. It quotes the police chief, Paul Pazin, as saying, "This is good stuff. It's a great program, and basically the report tells us what we believed." He added that he doesn't want to sound flippant, but the approach was somewhat of a known quantity because he's been talking about it with advocates for mental health and criminal justice reform for years. Denver just so happened to launch the program in the middle of a movement against police violence. That was really uplifting to read. And I'm wondering if you can elaborate a little bit on how that relationship evolved. Defund the police conversations really paralyzed communities. So we want to be able to overcome that and work within a system that exists, if we can, in a way that we can all redefine. It sounds like you're really redefining public safety. You've got these three levels, the three paths. And if you could talk a little bit about that and how everyone is invested in that, I'd appreciate it.
Yeah, I think that's the one thing that, and I grew up in Denver, so I'm definitely a Denver homer. I'm just incredibly proud of how our city has approached reforming how we look at policing. I know Denver they mandated that every officer get CIT trained back in, like, I believe 2010. All 100% of our officers, and now it's in the academy as just a standard training opportunity. In 2016, they took on the co-responder program before co-responder programs were even really a nationally kind of buzzword thing. I think that they've been really progressive on a recognition that their officers are not prepared to deal with some of the issues that come across. It's that idea of we need to move towards a 21st century view of how we're going about policing, not get stuck in 20th century what we did. So I'm very proud of the way Denver's been really forward thinking and how this works. And the S.T.A.R conversation really was me and my colleague cold calling Eugene, Oregon, and then walking down to the chief's office and saying, "Hey, what if we went up there and did X, Y, and Z?" And he's been supportive from the very beginning. And I think that helped. Our city council got on board with it. I think Representative Leslie Herod, who's our state representative, has been a big advocate. Denver did happen to pass a mental health tax. That's a 25-cent tax on every $100 spent. That helped fund the pilot of this program, so that we didn't have to, we didn't have to look at how do we find money for this. It was that money was there when this idea became an option. So we were able to tap into that funding. And I think there were people in the room that were the Denver Justice Project that were very we need to reform police. We don't want police. We need to retake all the money out of that. And I think everyone kind of, even if every idea wasn't agreed upon or thought of, everyone is in the room listening and being, using our ears, not our mouths, to actually take in and understand where other people were coming from and why it was coming that way. And we did that we're still doing it for about a year and a half now, of meeting with community members and really defining what this means to the Denver community as a whole, and what this is going to look like moving forward. And Chief Pazin has been an absolute advocate. While this is probably more a city thing, is the pilot for S.T.A.R did rest under the Denver Police Department, mainly because we had an existing co-responder contract, and city contracts take a little bit of time. And if we could just sneak that into the co-responder one, we were able to launch this much faster. But he recognized also that this didn't need to live in the police department. This wasn't something that was owned by the police department. It was owned by the community of Denver. And that's why when this pilot's done and the RFP goes out, it's going to live under the Denver Department of Health and DDPHE. And it's not going to be affiliated under the Denver Police Department. Now, they will be a partner the same way EMS will be a partner, the same way 911 will be a partner, and community membership. But it's not going to be owned by any one entity. It's a city model.
It was important to hear that all of the officers receive CIT training. I think even NAMI has been very active, even way back when in the development of CIT. So it's important to us that even with a community-based model that might do low-level call response, that we would have our officers all trained in CIT, because they will be the backups, and we do need them to de-escalate and be able to respond safely and appropriately, and for their own safety as well. So I really appreciate it. I'm hearing you say, so you have just police response, and then you have the police response that has the mental health professionals with them riding along, and then this the S.T.A.R model. But with the mental health professionals that travel with the officers, are those self-selecting officers that do that particular type of response? And do they always work just with, is the staff that's there for mental health, do they rotate out of like your mental health department, or are they people that work specifically with the police department?
So our staff worked specifically in this job. They were hired on to be mental health clinicians within the co-response model. In Denver, if you look around the nation, there is no one co-responder model that like fits everyone. It's a scatter shot, and I think it's a testament more to like how it works within your community. We were really intentional when we started this that we didn't want to be a model that was one officer that was really good at CIT, and any officer that came across someone could say, not my thing, I'm tapping out, call in the CIT team. We wanted us to be able to rotate with any officer at any given time and kind of let them observe our skills and how we interact with people, and through time be able to actually pick up on some of those skills. So we show up to roll call in those situations the same every single day, and it's once upon a time, it used to be a who wants to go with the clinician, and now it's kind of a fight over who's going to take them, because they recognize the value in what we provide, and also that we take work off of their shoulders. Like they don't have to fumble around in the dark for things that they're not aware of. Instead, they have someone with them that can actually be like I know this resource. Can we help this person get to that? So I think what we really were intentional on is that every officer has that connection to a co-responder and can request to ride with them. And that has worked really well since probably 6 months into our program, and has really kind of resonated throughout our entire community. To this year, we're going to be adding night shift, and night shift of like, I feel like I hear them screaming with glee in the middle of the night, just because they're usually the ones that are forgotten because it's the middle of the night, and they're just like, finally, we're getting a resource that we've been asking about when we're getting you guys forever. So just hearing that response from law enforcement is just kind of a breath of fresh air, given kind of how, it's not created equal across the nation of law enforcement wanting to buy into some of these models.
And how do you ensure safety of your non-police responders in S.T.A.R? I know Cahoots has had great success. They've said there's been no injuries. And so I'm just curious, what's that look like for you? How do you do that?
I think there's a little bit of experience that goes behind it. I think it's also a little bit of like, we definitely do like just situational awareness, like be aware of like where you're at, where you're standing, how you're standing in general. It's also one of those, I think there's a misconception of, I did case management for a very long time. This is no different than what I do when I was driving around with clients anyway. Like this is the work that I signed on for. And I've never interacted with individuals that I felt were dangerous. I come at them from a level of recovery and hope, and that I can help, how do I help get you to where you want to get to? I don't come at it from a level of fear. And usually people can read that and feel that about who they're interacting with. And when you're coming at it from how do I help support you, or where do you need to get to, or who can I help connect you with, it kind of lowers a defense, and it makes that communication a lot better, where it's just a conversation at that point, and people can really resonate with you. And I think, as we're always going to be mindful of where we're at and what we're going to, but these are, there's a social worker for every population. And this is my population that I just really, really love working with. And I think that there is great potential in a lot of people that society has kind of given up on. And I think this is our opportunity to kind of interact with them in a different way and provide supports and connection points that may facilitate some of that success.
Let's switch over to some logistics. A few of the things about the mechanics of implementing the program, and also how to report on the program. A couple of questions we had were, where did you repurpose the vehicles from another department? How did you implement that, fairly quickly, and how did you make that happen?
Yeah, I am so jealous of Eugene, Oregon's vans. Man, they are really pretty. So we had to get off really fast and light, and we wanted to see how we do this. So we actually took a civilian crash car. It's a civilian report taking van that it's still a little policey looking, but they stripped the lights off of it, put amber lights on, pulled a bunch of the benches out, and instead put kind of chairs. And it served its purpose for sure, but I'm looking forward to when money is actually present and expansion is an option to make a really pretty looking van that has a little more flair to it. So.
And can you describe it a little bit? You're saying that they took the benches out and there's chairs in there. Is it more like a casual setting so you can take a person in and you can talk with them? And
yeah, so it's side-by-side benches or seats, and we're able to help transport individuals. Sometimes on cold days, it's just have a conversation. Let's pop in here. I'll give you some hand warmers. Here's some water. Let's just talk about what's going on. We have a back area that actually has a wealth of kind of things that may benefit a situation. Water and food are always great talking points in general to be able to provide to someone. Even someone that doesn't want to talk is still willing to take kind of that as just a thank you for checking on me just to make sure I'm okay. But what we also noticed is that clients are really good at telling us what they need. And every single time we met with someone and they said, "Oh, I wish you had this here," we're like, "That's a great idea. We're going to put that on the van." So we've expanded that to be able to include, we have sweatpants, shirts, socks, space blankets, condoms, sunscreen, hygiene packs, a million masks, gloves. We actually have tampons. We recognize that there's also that people there are opiate based addictions out there. So we actually have safe needle deposits, as well as kind of the works, which is safe use kits. So that way we can either give them that or kind of take the old needles away from them. And basically they every single time electrolyte packs, every time we meet with someone, they always throw out there like, this would be a great thing. And we always say, you're right. We're going to make sure that we are incorporating that in that. And then attached with my partner is a Denver Health paramedic. And we also have all the stuff related to a basic life support kit. So gauze, the Band-Aids, antiseptics, all that stuff. And we're able to hand that out to people. And in some cases, our paramedics are actually able to treat wounds that would have historically probably ended in an ER stay, but instead are able to just kind of get taken care of in the community.
And you mentioned in your report the significant need for available supplies to support members of the community under your lessons learned.
Mm-hmm.
So where are you utilizing those materials? Do you get a lot of donations? Because we have a big network, a mutual aid network here in Tompkins County that has really stepped up and provided a lot of community needs during COVID, particularly. But also we have a food bank and several food pantries that do the same thing. So I'm curious how you're getting supplies like that.
Yeah, so we either get donations from entities around the community that are just like, this is a great program. We'd like to be able to donate X, Y, and Z. I'm actually on Friday, I'll be on the van, and the Girl Scouts of America, one of the troops actually donated like 100 boxes of cookies. So
wow.
We're going to be throwing. We actually had an unforeseen positive one in, I want to say July 2020, one of our local 9 News affiliates, he's like, I'm not going to run a story on it yet, maybe in the future, but I'm just going to post something on social media of like what you're doing and how you're doing, and maybe they can donate money. We've had about $10,000 that's been donated on any given time. So you might get something that can help support the van. And we're like, oh, cool. Like 24 hours later, it was Denver donated about $40,000 to be able to help support the van needs. So I think that was kind of one of those amazing things and that was before we even really knew what we had yet. So I think as we move forward, we'll probably look at that as a donation option for the community to be able to provide that, and then also find like more sustainable long-term ones that are maybe a little lower level, but can kind of make sure that we always have something available to provide support. And I think we're going to find out also, you know, how do we find emergency motel or shelter options on the van, like voucher wise, or transportation options related to like reconnecting individuals with their families that may live somewhere else. But I think exploring kind of what those options look like in the future is something we're going to be delving into.
It's a lot to think about. There's so many different options, I think, and I think the more people are going to hear about this and listen to this conversation, ideas are going to start churning. I mentioned before the data and the way you're tracking this information. I was really impressed with that. Oftentimes we start a program and then we don't really know how to understand its effectiveness without the tracking. So many of the points that you're tracking are really important. And I really liked the idea of not having these calls and the information about people specifically with regard to mental health and such being part of your law enforcement database, which is really, it goes a long way to decriminalizing crisis and mental health, mental illness. So could you talk a little bit about that tracking? And also I'm wondering if you use the sequential mapping tracking at all to help you develop this program, and if any of this tracking is like a furtherance of that process.
Yeah, I think as we collected data, again, we definitely stood on the backs of the co-responder unit. That was 5 years of kind of navigating through the dark on data to get to even where we're at now, where S.T.A.R didn't have to do that. We said, okay, this is what we can do on existing data collection and then just expand on it. What we did do was tap into the Department of Safety, who definitely, basically anyone that calls 911 where S.T.A.R is an appropriate response, the 911 operator is actually hotkeying that as a S.T.A.R call, and it's collecting the data that they've been able to do for decades and decades on the back end to actually do the more like, here's the amount of calls, here's the time on a call, here's the hot buttons attached with, or hot days related to calls, and really kind of map out what our future expansion is going to look like. And then from our side, we've always been really intentional on our program that we do not, we're contracted with the city, but we're a protected health organization. So everything that we collect goes into our HIPAA protected system. And the city doesn't have access to that. And the same with our side is we don't have access to their system. We were pretty intentional that we wanted to work on a partnership together where we can share data together, but we don't want to be able to access each other's just in general. And then from our side, because I don't think it's important for people to know individual data. I think it's important for us to be able to display this in aggregate and say, here's what we're experiencing behavioral health wise in the city. And here is where we're experiencing it, and how do we get resources proactively before 911 is connected. So I think from our standpoint, we've been doing a very good job of being able to maintain those boundaries and not feel like someone isn't stepping up to the plate enough to be able to provide those supports. I feel like I missed that last question you had.
I was just asking about the sequential mapping.
Yeah.
If your community went through that prior to trying to implement even your co-responder program, just to better understand the needs.
Absolutely, they did. And then I think how we've, so our co-responder definitely was at the Intercept one, where we were trying to figure out what it's going to look like. And in the past 5 years, the Mental Health Center of Denver has we've integrated into court systems, to competency-based systems, to probation systems, and really every line along the sequential intercept model, except 0, which is where S.T.A.R kind of is that desired goal. So I hope that theoretically, when we started this, we were like, well, we just think these programs are going to talk to each other. Like there's not going to be a silo that's going to work. And then now that we have every sequential intercept, we're seeing emails and communication amongst these teams where we're like, hey, I've seen this person, like this is what we're going to do, where I'm going to talk with the lawyer to divert them. Can S.T.A.R come and pick them up and get them to here? And really showing a network that really is collaborative and really is intended to keep people out of the criminal justice system and connected to those longer term supports that are hopefully established.
Great. Our community did undergo that process in 2019. I believe they finished that. So I'm hoping that that's a useful tool in this process as well. Another thing that you mentioned in the report, or that was mentioned in the report, is the tracking that you did to see what you were not able to actually respond to because you weren't implemented fully at this point. So I found that really interesting that you were already kind of prescient in that you were really trying to see what your effectiveness would be going forward if you had more.
Yeah, and that's that hotkey system. As we recognize, like downtown Denver, they can tell us here is the amount of S.T.A.R calls, and we wanted to know the entire city, if S.T.A.R was available, how many of those could we have gone to? And they just started saying we can't send anyone, but here would have been a good S.T.A.R call, and that was about 4 times as much as the average call that we went on. So we're able to show that, yes, if we had more vans, we could actually reduce the likelihood of, 1, police having to go to those calls, 2, whatever outcomes would have come from those calls, and that we've shown that we probably could have successfully managed those calls and got whatever that crisis was to the right response without having to have the individual in danger or whatever entity's responding in danger.
Would you, after 6 months, would you consider changing or modifying any of those call types after reassessing that? Are there any that you would not do or you think you could handle?
Yes, I think there's going to be evaluation of how. I think there's like 6 buckets that we kind of fall into. I think there is ability to kind of explore a little bit more beyond that. But it's weird because it's a little bit of the 911 system and how they flag certain things. I think there's definitely calls that we could take on that would be a little bit low level, that are just maybe flagged on the front end a little bit weirder, that comes across as, no, this wouldn't be a good S.T.A.R call, but it might be. And I think that's the conversations and the open dialogue that we have with 911 to be able to have those conversations of what we could respond to.
I have a couple more questions about the response. And one is, do you handle any involuntary hospitalization transports?
We do. I think out of the 1,094, I think we've only had to do about 25 mental health holds. And that is because someone has thoroughly met the criteria for danger to themselves. And in those situations, I think the learning curve that we're kind of experiencing is that having to go to the hospital is a scary situation when you're not informed of what the heck is going on during that interaction. So I've only had to do one on my side, but when I did that individual was just like, I just don't have a great relationship when it comes to like an ambulance showing up and me having to get transported. And I said, well, and that was the benefit of having the paramedic with me. I said, well, here's what the process looks like. I'm just concerned about your safety. And I know you keep telling me you can't, if I walked away, like you don't think you'd be able to be safe. And that concerns me. And I really want to make sure that your life, like we can get you, supports to be able to kind of live a life worth living. So here's what's going to happen is my friend's going to call an ambulance unless you feel that you could transport with me in a safe manner. And sometimes someone will be like, I don't know if I can. In that situation, I was able to say, yeah, I feel comfortable transporting you. You're comfortable going with me. And we just brought them straight to the hospital. Because we had that relationship going, I was able to walk into the Psych-ER. I was able to introduce them to the psychiatric nurse and the psychiatric doc. I said, here's what we talked about. Here's what I'm going to have one of my case managers that is on the back end be able to follow up with him to get him connected with services. And I think that kind of took away the unknown of, I'm just going to get dumped here and someone else is going to have to reinvent the wheel on what's going on with me. And it was really kind of laying down, here's the framework that we're going to do. And then that person actually got held overnight and he was still in the Psych-ER, but they were going to release him the next day. And they just coordinated back with us for us to pick him up and bring him back home. He felt better. He felt like he was rested. He was able to get his needs met in that moment. And he still followed up with the plan to get connected with long-term services and our case management on the back end. And I think he had a better trauma-informed experience versus the possibility of having to go in an ambulance and, possibly tied down and whatever might have happened on the transition attached with that. So And then in other situations, it's still being able to, I think a lot of that is just being able to communicate with someone and build a relationship with them and build a rapport to say, I'm going to be there with you. The ones that we do have to transport occasionally with an ambulance, it's historically a no-no to have a rider with you in the ambulance because they know what we're doing. They've allowed us to be in the ambulance with that individual to actually kind of talk them through the drive, which has been really beneficial. And most of these individuals, by the time they get there, they voluntarily walk off the van and walk in there and recognize that we're doing that more as a safety for their well-being. But I think most of those is also, we're connecting people to the walk-in crisis center, which I think is the goal, because hospitals are not a great use for some of these, like a walk-in crisis center that has a therapist that doesn't, that you can stay for 24 hours and kind of game plan what safety looks like and what long-term support looks like. That's a more appropriate response. And that's usually the conversations we're having with individuals. But every once in a while there is that we just can't get a contract for safety, and we just need to make sure that there's a safety net for that person.
And imagine the qualifications for the 911 dispatcher. How did that evolve? So you now have, I guess you've gone through some steps because you had the co-responder program, so they knew how to kind of assess that and who would need to respond to that. But is it just that your call types are so specific and so low risk that it's fairly easy for them to adapt to this new model of sending services?
Yeah, I think they were given a training, and they're consistently given updates of like, this is how to get the response that is most appropriate. But yeah, I think they've been great about like being responsive to, hey, this was, this call just came across the radio. That's something S.T.A.R could go on in the future, and just being, and we're very familiar with the call takers that are on during that shift that we're in. So they're very familiar with how to utilize this in the most appropriate way. And that's kind of one of the things I valued the most about Eugene, the fact that their 911 center said, come on up and we'll educate your 911 people on what questions we're asking, and all basically give them 30 years of the cheat codes of how to interact with individuals that are contacting 911. And I think that's been incredibly helpful, where they didn't miss a beat of what we're able to respond to.
Thank you. I think I just have a couple more questions. So at NAMI, you mentioned that you had participated in the NAMI board at NAMI Denver. And so you are familiar with what families experience. Family members are very often the people who make these calls for crisis for their loved ones. And we often live with the consequences of doing that. So the prospect of having a much kinder and more compassionate way to respond to a person's mental health crisis is very appealing to us. Can you talk a little bit about how NAMI can help facilitate this sort of thing in our community? What support do you need from organizations like NAMI?
I've always valued the ability for families that just feel so isolated and that this is only happening to them and they don't know where to reach out to be able to give them a resource to say there's a community out there that knows what you're going through and can be very supportive around what's going on. As these kind of responses happen, I think it's not just, it's interacting with the whole system. It's not just the individual that's in crisis. It's being able to explain the situation and what's currently going on to entities that are around that person, either the person making the call or the support system of what is it that you're experiencing with this individual that maybe they're not telling me, and how can we do that? How can we help facilitate a better outcome for future calls where 911 doesn't have to be the go-to anymore? And I think that's part of Denver's model. I always thought our co-responder team was amazing. And then we got case managers to kind of do follow-up back-end support. And it's like the greatest revelation we've ever had in our entire life. I mean, they are the most amazing people it's not just the Band-Aid triage and then we're hoping that person connects to the right service. It's us ensuring that, hey, this is the plan we're making today, either on S.T.A.R or co-responders, and I'm going to have our case manager show up tomorrow to make sure that that plan is either modified or that they can help usher you to that next step. So it really is a wraparound kind of response. And then they kind of have that ability to tag along as needed and really work with families, especially for our individuals that might not have a ton of insight into their mental illness, of providing support for the family, but also providing options, resources, different thoughts or ideas that we haven't really considered, to make sure that people feel that they are supported. Because I know, the overwhelming theme that I sometimes hear from a lot of our NAMI families is they just don't know what to do, and they feel like they've tried every avenue. And I think sometimes that's where that creativeness needs to come into play, of entities that know the systems and different resources and different connections to say, well, let's try something outside of the box to really kind of see if we can help support your loved one in this time of need.
Thank you. Okay, well, I think that's all that I have. So if people have questions, go ahead and type them in the chat, and I will relay them to Chris. Someone asked what the community's response in general to your local police department is. What is that relationship like?
I think it's like what most cities are. I think it's a mixed bag. I think there's people that kind of recognize that there's a support that needs to be provided to law enforcement for like what they're going to. A lot of it is like, how do we give, part of this is they got into law enforcement attached with, criminal justice, and how do we make sure that we keep bad guys in jail and that the community is safe. And we're not trying to turn them into mental health workers, but how do we give them resources to be able to actually respond to these with the correct responses. And then we have other members of our community that are like, police budget's too big and they shouldn't be all that. I think if anything, there's a lot of community discussion that's been pretty open and transparent. And I don't think anyone necessarily, Chief Payson specifically, isn't saying one way is right or wrong. It's a discussion point that things do need to change, and things need to really be looked at from different lenses that aren't just, we have been doing this for years, so let's just keep doing it. I think Denver is really receptive to, we need to really look internally and make changes, and has started at least in the step in that right direction to be able to do that.
Okay. So Tammy Baker is one of our community outreach workers in Ithaca, and she's asking how many 911 calls versus street outreach contacts are you making? So I'm thinking maybe just connections that you're making, responding that you're doing without the 911 call. Are you doing any of that?
I think self-initiated is about 20%. Our goal is that when we are rolling this citywide, that there's no such thing as downtime, kind of. If 911, I've always been a fan of, if 911 calls and the radio is quiet, that means Denver is doing exceptionally well. Things aren't bad. Like, that means if we're not doing work, that means people are doing well, and that's a good thing. But that also gives us the opportunity to be proactive and start going to communities, and whether that's individuals or unhoused neighbors and communicating with them, if it's showing up to organizations that may not know what we are, and us just kind of explaining how we can be an asset to them, but really getting our name out there as like, we're not just a response mechanism, we can be proactive. And like, there's been numerous times where I've just driven up Colfax, which is one of our busiest intersections, and I just see something and I'm like, someone's calling 911 on that. We might as well just go and see if we can talk to this guy proactively. And it's benign, and it's usually like, oh, like, I'm just not doing well, I need to get to the shelter. And it's like, cool, like, I'll take you to the shelter if you want to, and we can talk whatever's going on in the interim. And I think sometimes that's, it's seeing stuff that's happening in our community, or understanding a little bit of like where things are maybe escalating, and just being able to go out there and see if we can diffuse it a little bit just through interactions with people and lighthearted conversation.
Thank you. Deborah Grantham is our NAMI Finger Lakes board president currently. She's asking, since you've gotten S.T.A.R underway, what has surprised you and what didn't you expect that happened?
I think honestly, the surprise has been that we haven't had to call police on any of these calls, that it it got off the ground so smoothly. I didn't think that was going to happen. I thought for sure we were going to be stumbling over our feet, but it actually went pretty smoothly. And then I don't know. I guess I still think of Denver as like a very small city, and I've been pretty amazed at the amount of like other communities throughout the entire nation that are kind of saying, "How do we get this information out there?" And being able to just take the time to be able to talk with those entities and say, "Yes, like I'm all for these being everywhere. How much time do you need of me to be able to kind of give you the nuts and bolts?" And kind of the overwhelming of like everyone in the nation seems like very big on this is where they want to move to. And that's very exciting for me to say, yes, I'm glad everyone's on board. Most people are on board. How do we get there then? And being able to support them any way we can.
You do sound excited about it. So it's nice to hear you be so enthusiastic. And I'm really pleased to have you share that excitement with us. Howard Reed is a NAMI board member. He's asking, is there a psychiatric mobile crisis team in Denver? And if so, how does S.T.A.R's work relate to it?
There is. They don't really cross paths very often. So our mobile crisis unit is partnered with our statewide call center. So anybody that needs to talk with a therapist can call this number at any given time, 24/7, and talk with the therapist about whatever it is they're going through or experiencing. And if it tips over into someone is concerned about that person's well-being, that therapist will then call mobile crisis, who will respond to that individual just to do a clinical assessment. And that's primarily how they're utilized. And that tends to be outside of our realm right now, at least. That's not to say that we wouldn't do that on any given call, but we're not associated right now with that statewide call line.
Thank you. And Tammy is asking, where do you transport someone that is intoxicated, needs a place to sober up, but not necessarily sent to the hospital?
Great question. So there is a lack of options related to that. I think nationwide, but Denver definitely is experiencing that. We have detox, so we can bring someone to detox, but there is a little bit of trauma sometimes for people that have experienced that. We also, the Mental Health Center of Denver, we have a lot of facilities, either walk-in centers. We have day programs that we're able to kind of say, kind of harm reduction, like how intoxicated is this person? The paramedics giving them a once over to make sure there's no underlying health issues that they're concerned about. And if it's, well, we just need to get you somewhere to sober up, like we're able to utilize some of those facilities to make sure that happens. And it's kind of at the discretion of that individual. We'll give them options. And if they say, yeah, I think I can actually go to like a day place and I'll just sit on the couch and kind of sober up over time, then we'll take them there. If they're like, I'm really intoxicated, I need to go to detox because I'm concerned, we'll take them there as well. And then there's individuals, especially under the influence of opiates, that we've encountered that have said, I am tired of using and I need to get help. And we give them the opportunity of like, well, we have MAT inductions and we have Suboxone clinics. Like, you tell me what would be most beneficial for you. And if that person in that moment is saying, yeah, I want to get off heroin and I want to get on methadone, we'll drive them right to the MAT induction clinic. We have a really great relationship with them, and they'll basically remove all barriers to get that person on methadone same day and out the door and part of their treatment program. And that's kind of where I think we are able to kind of help those individuals. I'm a big fan of never judging where someone is presenting as. I've been on calls where I've held someone's liquor bottle. I've been on calls where I've held someone marijuana pipe as they got into the thing. And I'm like, okay, at the end of the day, as long as you're safe and I'm safe, like I'm not losing sleep over wherever you need to be right now. And when you're ready to make changes, I'm going to be there to support you. And you just tell me when you're ready. And if it's interaction number 9, then great. That means that me and you have met each other 9 times. And hopefully we have a really good banter between us that I'm able to help get you to that place that you're seeking at that moment.
It's really very moving to hear you talk about that, because it sounds like a real effort to restore dignity for people and their humanity and to meet them right where they are. So it's really valuable to hear that. Thank you. If a community has neither a co-responder program nor a S.T.A.R type program, which would you recommend be the priority for development?
Ooh, that's like a Sophie's Choice moment. I am probably super biased on this. I think both models have been shown to be effective. I mean, Eugene did the S.T.A.R model and did it in with a relationship with law enforcement, but didn't have that direct interaction. Versus Denver, we kind of got embedded with law enforcement and weaseled our way into like getting them to kind of shift their outlook on how they're responding. And I think both can be super effective. It really is just kind of saying, what is it that's most needed? Are there more low level things that can be responded to versus kind of those higher level calls and being able to take that? And I think a little of it is listening to the community and that, law enforcement's part of that community and saying, what is it that they're asking for too? Like, what is it they're recognizing? Are they looking for police support or are they looking for something to take off their plate? And then being able to run kind of with whatever it is that is data informed, but also seems to be something that they buy into or any industry would buy into.
So I don't see any more questions in the chat right now. So if anyone has any questions that you'd like to ask, go ahead and put them in the chat. I wanted to ask you, we've talked a lot about these, the services that help support the work that you're doing for handoffs in the community once you respond to them. So now that you're recognizing, or your community is recognizing, the importance of how your service can go forward, is there a change in the mindset about funding on the county level, state level, for the services and supporting them, making them more robust in order to help you realize success here?
Yes, at the city level for sure. I know. I think as we referenced the Caring for Denver funding that is related, we always look at it as how many vans can we get, how many staff can we get to go out and respond to that. And what we've started to change the conversation to is kind of that concentric circle idea. Is the S.T.A.R van is a response mechanism. How do we fund a second tier option that actually either funds programs, incentivizes programs to actually say, it's not, I can get you in the door 2 weeks from now. It's, I can get you in the door when the S.T.A.R van shows up because this person says this is what they're looking for. And I think that's the next conversation of how do we actually get either programs started or existing programs to actually kind of work in a tear down the silo. We're all working as a part of a system together and communicating together of how to best meet the need. And I think that's what these programs really the meat and the potatoes isn't the upfront thing. That's where we're really good at selling. Here is the services we can help connect you to, but it's the back end supports that really are the ones that kind of help that person progress in their recovery, whatever that might be. And we want to work with those individuals, but if the back end isn't there, or it's a promise that is unfulfilled, then that person just feels like they are being lied to and scammed, and they're not going to trust what S.T.A.R is even attempting to sell. So the benefit of myself being with the Mental Health Center at Denver is I know how to get someone in the front door as fast as I can. And if I can't get them in a very short amount of time, within 24 hours, I have my team that I can actually call on to say, I need you to meet with this person tomorrow and bring them into services because they're saying they're ready. And I think that's the most important thing that our community needs to listen to is when someone says that they're ready to make a change or take a leap of faith, that needs to be honored and respected, and we need to be able to provide it to them. And it can't just be lip service or a referral service. It has to be immediate service because that's when we, see the most change is when people are ready for it, not when they're forced into it. And I think that's the next step is how do we get those front doors kicked in, open, unlocked, whatever it looks like to make sure that we're supporting our community.
That requires a big change in mindset in looking at this community as people who have value that deserve an investment rather than a burden that we're always trying to figure out how to fund.
Yep.
So it really does require a shift, I think. Tammy is asking, how do you manage a person that is having a drug-induced psychosis? And if there is an underlying mental health condition that is untreated? She said he's kind of answering that now, but.
Yeah. Well, one, we're always working with people and we're really talking to them. And I think the biggest thing is motivational interviewing is recognizing that someone that may be in the throes of psychosis or delusional thought or delusional, responding to internal stimuli, if what they're telling me is I don't hear any voices, I'm not delusional, I'm not paranoid, but I have a lot of anxiety, I will latch onto that anxiety thing and say, well, what can I do to help with the anxiety? Like if me working on that anxiety gets them through the front door to hopefully have future conversations about psychosis, that's where we'll go with it. We will go with what that person is giving us and what they want to work on, with the idea that eventually conversations will happen around that slowly as relationships are built. The drug-induced psychosis, some of my favorite people. I think it's about it really is. It's about space. It's about giving them a safe space to be in. It's taking time. It's showing that I've been around people that have been hypermanic. I've been around people on meth. I've been around people that just are like bouncing from one thought to the other, and it's just kind of saying, okay, we're going to ride this out for the moment. And until something presents where there's a concern, like we're going to ride this out. Like, do we need to go for a walk around this park to kind of get some energy out? Like, and in most situations, people under the influence, they're not inherently violent. They may do some erratic behavior, but that doesn't mean that they're a danger to the community. It just means that they're experiencing something that's a little outside the spectrum of what we consider normal. So I think it's being able to be present with them. It's a whole nother TED talk of excited delirium and whether or not it's a real thing. I'll get on my soapbox on that on another day. But I think, a lot of this is, if we responded to someone that was kind of that what these programs do is they're interlocked, is if S.T.A.R goes to something like that and it's outside of our scope or someone's presenting as danger, we can radio up and actually ask for the next response, which isn't police, it's co-responders. Can I get a co-responder here? And then it's 2 clinicians and 1 officer, and we can brainstorm, how do we make sure this person's safe? How do we make sure we get the best service to that person? And then if it escalates even further where there's even more danger, then it's just additional backup for police. But we still have clinical lenses on the situation to give our 2 cents of how do we manage that. And if we have history, we're able to kind of use that history we have on someone to really kind of be able to get them to a level where we're like, we just need you. We just want to keep you safe right now. And whatever that looks like, we're going to, we'll be here with you in that moment. So hopefully we don't see any negative outcomes.
Another person on our call is Beth Harrington, and I believe she's on the board of our local suicide prevention crisis services. And it just occurred to me, NAMI has been advocating for funding for the new 988 suicide prevention number. So how that's supposed to be in place in July of 2022, I believe. So are you working at all and like building out a crisis hub with that in mind and getting funding for that? And how is that incorporated in what you're doing?
I have been in a few meetings related to 988, but not enough to be informed enough about it, other than it seems like a pretty awesome in Denver, and we're hoping that it can incorporate all of our existing crisis responses as part of a response to those. So,
okay. I'm not seeing any more questions. I think that you have really expanded on so many ideas, and I've really enjoyed this conversation. The questions that we got to follow up were terrific too. I do want to be mindful of your time, but I want to give everyone just one more opportunity. If there's any last minute question you have for Chris, if you want to share it in the chat, and if there are no more, then I'll give you a chance, Chris, to close out if you'd like, if you have any final thoughts that you want to leave us with.
I just really appreciate the time and the audience to be able to kind of share on what our program is and how we can best give information to you guys to hopefully facilitate one in your area. And always keep us in mind that if there's any community meetings or stakeholder meetings that we can give our 2 cents to those individuals or help inform the conversation, that you are absolutely able to reach out to me, and we'll definitely do the best we can to kind of help nudge these programs along.
Fantastic. And so you said that you all went up and you shadowed with Cahoots in their community. Is that something that you would be willing to do once COVID is kind of under control?
In a perfect world, when COVID is not an issue, we will absolutely look at how we can help facilitate these through experiential learning in the community. So hopefully we'll June, July, fingers crossed, and then we'll figure out a plan for that.
Great. This has really been an inspiring conversation. Your excitement about this is a little contagious. So I really appreciate you sharing that with us. Again, really offering our condolences to your communities. It is a very small world, and you're very close to that right now. So you are in our thoughts, and really grateful that you shared your time with us tonight, even so. So
thank you guys.
And thank you to everyone, all of our attendees. Appreciate your attending this evening, and have a good night.